Patient today asked about cosmetic pharmacology. Cosmetic pharmacology is a term originally coined in 1990 by Peter Kramer, who then in 1993 wrote a book called Listening to Prozac. This is actually a pretty controversial term, cosmetic pharmacology, or controversial topic. And I'm just giving some basic information about the idea. I'm not actually advocating for cosmetic pharmacology for anyone out there. But what this means is that medications that are used in psychiatry have the potential to be used in mentally stable individuals for the purpose of altering their personality or the way they feel in some way, even when those individuals do not have significant psychiatric illness. I can give a couple of examples. My father was a urologist in southern New Jersey, and urologists, it's not uncommon for them to see patients that have various difficulties, and one of them is premature ejaculation. So an individual saw my father. He was their urologist. He wanted to be seen for premature ejaculation, and my dad put him on Prozac. Prozac is an SSRI, or selective serotonin reuptake inhibitor, and it's known to cause delayed ejaculation. So it's actually a treatment for premature ejaculation. My father put him on this medication. The guy came back in, and my dad said, "Oh, how have you been since the last visit? How's the medication working?" And the patient said, "Well, I don't really notice too much of a difference in terms of the premature ejaculation issue." My dad said, "All right, well, if that's the case, then we'll just go ahead and stop the Prozac." And the patient said, "Well, I'd actually like to continue it." And my dad said, "Well, I'm not really sure I understand. Why would you want to continue this medication?" And the individual, who never really had a history of depression, never had a history of significant anxiety, just said, ever since being on that medication, I've just been a little bit more calm, and I've been getting along better with my significant other at home. And they said, I need to just stay on it. And my dad said, "Well, I'm not a psychiatrist. I don't prescribe medications for that purpose, but I want you to see a psychiatrist. And if they feel like it's indicated or reasonable for you to continue, then sure, that's fine if you do, but I'm not going to want to write you that prescription." So in that instance, this individual wanted to be on Prozac because it changed the way that they felt, or changed the way that they were interacting with others, etc., when they were actually an overall healthy person in terms of having no psychiatric illness. Other examples are there are certain medications that are used in psychiatry for intermittent explosive personality disorder, or anger problems, or individuals that have very intense emotions that can get them into trouble at times. An example might be, it's not uncommon practice for a psychiatrist to prescribe Lamictal for a patient who tends to have really big problems with anger, or who tends to, when they're upset, engage in behaviors that could be dangerous, like cutting themselves or burning themselves or things like that. So you often will use a medication for the purpose of evening out the person's mood, and there might be certain situations, or kind of the things that I've described, where it makes sense, or it's reasonable to do a trial and to see if you can improve the person's reactions or reactivity, etc. But those types of treatment are what you would refer to as cosmetic pharmacology. Again, I'm not advocating for the use of cosmetic pharmacology. Psychiatric medications are not to be taken by individuals if there's not a clear reason of why a trial makes sense. But it's just pretty an interesting topic that, again, was coined in 1990, and it definitely provokes a lot of interesting discussion. If you believe this video pertained to you in any way, please be sure to reach out to a mental health provider directly to discuss. These videos are informative only and not meant to be medical advice for anyone out there.